Mitosis, when the cell splits apart. What is mitosis? Eventually, cells need to duplicate. There are two main methods of replication: mitosis and meiosis. This tutorial will talk about mitosis. The big idea to remember is that mitosis is the simple duplication of a cell and all its parts. It duplicates its DNA, and the two new cells, daughter cells, have the same pieces and genetic code. Two identical copies come from one original. Beyond the idea that two identical cells are created, there are certain steps in the process. Before a cell divides, it is in resting phase. The cell in resting phase is not actually resting, since it has to maintain its reservoir before it undergoes division. This phase is called interphase. It prepares the cell for division, i.e., protein synthesis, DNA duplication, and enzymes. After this phase comes mitosis, which is further divided into karyokinesis, division of nucleus, and cytokinesis, division of cytoplasm. Karyokinesis involves the four basic steps of mitosis that are prophase, metaphase, anaphase, telophase. Here we start with prophase. The chromosomes start coiling and become condensed. Nuclear envelope disintegrates. Gene transcription ceases during prophase and does not resume until late anaphase to early G1 phase. The nucleolus also disappears during early prophase. Centrosome gives rise to mitotic apparatus, i.e., generation of spindle tubules. Metaphase. Now all the pieces are aligning themselves for the big split. The DNA lines up along a central axis, and the DNA, chromatin, has now condensed into chromosomes. Two strands of chromosome are connected at the center of the centromere. The tubules connect to the centromere, not the DNA. Anaphase. Here we go. The separation begins. Half of the chromosomes are pulled to one side of the cell. Half go the other way. When the chromosomes get to the side of the cell, it's time to move on to telophase. Telophase. Now the division is finishing up. This is the time when the nuclear envelope begins to synthesize again along the separated chromosomes. Cytokinesis pinches the cell membrane in the middle. Cell membrane closes in and splits the cell into two. Now we have two separate cells, each with half of the original DNA. Up till now, we have discussed what is mitosis and its different phases. Now it's important to know about significance of mitosis. Significance. It is an equational division through which identical daughter cells are produced, having the same amount and type of genetic constitution as that of the parent cell. It is responsible for growth and development of multicellular organisms from a single-celled zygote. The number of chromosomes remains the same in all cells produced by this division. Thus, the daughter cells retain the same character as those of the parent cell. It helps the cell in maintaining proper size. Mitosis helps in restoring wear and tear in body tissues, replacement of damaged or lost part, healing of wounds, and regeneration of detached parts, as in the tail of lizards. It is a method of multiplication in unicellular organisms. If mitosis remains unchecked, it may result in uncontrolled growth of cells, leading to cancer or tumor. The next important phase of cell cycle is meiosis. Have you ever wondered why you are different from your siblings? The answer lies within the amazing process of meiosis. What is meiosis? Meiosis is a process where a single cell divides twice to produce four cells containing half the original amount of genetic information. These cells are our sex cells, sperm in males, eggs in females. During meiosis, one cell divides twice to form four daughter cells. These four daughter cells only have half the number of chromosomes than the parent cell. They are haploid. Meiosis takes place in germ or sex cells called gametes, eggs in females and sperm in males. Similar to mitosis, cells also pass through the interphase, G1, S, and G2 phase before they enter meiosis. Here are the distinct phases of meiosis. Interphase, meiosis 1, Cytokinesis 1, Meiosis 2, cytokinesis 2. First at interphase. In interphase, DNA is copied, resulting in two identical full sets of chromosomes to prepare for division. Outside of the nucleus are two centrosomes, each containing a pair of centrioles. These structures are critical for the process of cell division. In next step at Meiosis 1 takes place in following steps. Prophase 1. Prophase 1 is typically the longest phase of meiosis. During prophase 1, homologous chromosomes pair and exchange DNA, homologous recombination. The new combinations of DNA created during crossover are a significant source of genetic variation and result in new combinations of alleles, which may be beneficial. The paired and replicated chromosomes are called bivalents or tetrads, which have 2 chromosomes and 4 chromatids, with 1 chromosome coming from each parent. The process of pairing the homologous chromosomes is called synapsis. At this stage, non-sister chromatids may cross over at points called chiasmata, plural, singular chiasma. Prophase 1 has historically been divided into a series of substages, which are named according to the appearance of chromosomes. Leptotene. In this stage of prophase 1, individual chromosomes, each consisting of 2 sister chromatids, become individualized to form visible strands within the nucleus. Leptotene is of very short duration, and it's when the progressive condensation and coiling of chromosome fibers takes place. Zygotene. Chromosomes approximately line up with each other into homologous chromosome pairs through synaptonemal complex. The paired chromosomes are called bivalent or tetrad chromosomes. Pachytene. This is the stage when homologous recombination, including chromosomal crossover, crossing over, occurs. Non-sister chromatids of homologous chromosomes may exchange segments over regions of homology. At the sites where exchange happens, chiasmata form. Diplotene. The synaptonemal complex degrades and homologous chromosomes separate from one another a little. However, the homologous chromosomes of each bivalent remain tightly bound at chiasmata. The regions where crossing over occurred, the chiasmata remain on the chromosomes until they are at the transition to anaphase 1. Diakinesis. It closely resembles prometaphase of mitosis. The nucleoli disappear. The nuclear membrane disintegrates into vesicles, and the meiotic spindle begins to form. Synchronous process. During these stages, 2 centrosomes, containing a pair of centrioles in animal cells, migrate to the 2 poles of the cell. The microtubules invade the nuclear region after the nuclear envelope disintegrates, attaching to the chromosomes at the kinetochore. The kinetochore functions as a motor, pulling the chromosomes along the attached microtubule. Microtubules that attach to the kinetochores are known as kinetochore microtubules. Other microtubules will interact with microtubules from the opposite centrosome. These are called non-kinetochore microtubules or polar microtubules. Metaphase 1. Homologous pairs move together along the metaphase plate. The paired homologous chromosomes align along an equatorial plane that bisects the spindle. Anaphase 1. Kinetochore microtubules shorten, pulling homologous chromosomes, which consist of a pair of sister chromatids, to opposite poles. Non-kinetochore microtubules lengthen, pushing the centrosome further apart. The cell elongates in preparation for division down the center. Telophase 1. The first meiotic division effectively ends when the chromosomes arrive at the poles. Each daughter cell now has half the number of chromosomes, but each chromosome consists of a pair of chromatids. The microtubules that make up the spindle network disappear, and a new nuclear membrane surrounds each haploid set. The chromosomes uncoil back into chromatin. Cytokinesis, the pinching of the cell membrane in animal cells or the formation of the cell wall in plant cells occurs, completing the creation of 2 daughter cells. Sister chromatids remain attached during telophase 1. Cells may enter a period of rest known as interkinesis or interphase 2. No DNA replication occurs during this stage. Meiosis II. Meiosis II is the second meiotic division and usually involves equational segregation, or separation of sister chromatids. Mechanically, the process is similar to mitosis, though its genetic results are fundamentally different. The end result of meiosis II is production of 4 haploid cells, N chromosomes, 23 in humans. The 4 main steps of meiosis II are prophase II, metaphase II, anaphase II, and telophase II. In prophase II, we see the disappearance of the nucleoli and the nuclear envelope again, as well as the shortening and thickening of the chromatids. Centrosomes move to the polar regions and arrange spindle fibers for the second meiotic division. In metaphase II, the centromeres contain 2 kinetochores that attach to spindle fibers from the centrosomes at opposite poles. This is followed by anaphase II, in which the remaining centromeric cohesion is cleaved, allowing the sister chromatids to segregate. The sister chromatids by convention are now called sister chromosomes as they move toward opposing poles. The process ends with telophase II, which is similar to telophase I and is marked by the disassembly of the spindle and decondensation and lengthening of the chromosomes. Nuclear envelopes reform and cleavage or cell plate formation eventually produces a total of 4 daughter cells, each with a haploid set of chromosomes. Meiosis is now complete and ends up with 4 new daughter cells.
Necrosis versus apoptosis. Hello everyone. This tutorial will explain to you the main difference between apoptosis and necrosis. Introduction. All cells in a multicellular organism undergo growth and death. Cellular death is essential for an organism to grow and survive. Human body is made up of innumerable types of cells in various parts of the body. There are mainly 2 types in which a cell undergoes death, either through exposure to harmful environment, injury, or through a pre-planned and regulated process of disintegration. Cell death occurs via 2 different processes, one being necrosis and the other being apoptosis. Now the question is, what is necrosis? Necrosis is a process of cellular death, which occurs when cells are exposed to extreme conditions, which are very different from normal living conditions. This leads to damage to the internal cellular environment and rapid cell and tissue damage. So the basic inability of the cell to maintain balance when exposed to rough conditions leads to complete discord in the cell's functioning and eventually its death. What is apoptosis? Apoptosis is a pre-planned regular process of cell death occurring in the body where the cell itself actively takes part in its own death. It occurs as part of normal cellular multiplication and turnover. So cells die naturally to maintain a balance of the cellular multiplication. Apoptosis is required for smooth functioning of the body. Most cells in the body have a shelf life. For example, red blood cells live for 120 days. At the end, they are destroyed in the body. This is a method of apoptosis. Difference in cause and presentation. Necrosis is a pathological process which is detrimental to the body. It occurs when the cells are exposed to toxins or on exposure to extreme conditions which could be anything from increased temperature, decreased oxygen levels, etc. These conditions lead to damage to the wall or membrane of the cell. An inability to maintain normal functioning in these conditions leads to an imbalance in the internal environment of the cell. This leads to inflammation and tissue damage, which leads to accumulation of cellular debris. Apoptosis is a normal, natural process which is necessary for the body as it maintains a balance in the number of cells in the body. If the cells do not die on time, it can lead to a tumor or cancer formation, which is an accumulation of unwanted cells. If cells die too fast, it can lead to conditions such as AIDS, heart disease, and liver disease. So if apoptosis does not take place as it should, there will be signs of disease. Difference in structural changes. In necrosis, there is a loss of integrity of the wall of the cell, which leads to swelling of the cell's contents as well as disintegration of small bodies of the cell. In apoptosis, there is no disintegration of the cell membrane or wall, rather there is a shrinkage of cellular contents along with clumping of the membrane. This leads to formation of condensed bodies known as apoptotic bodies. These bodies are recognized by the immune system of the body and destroyed efficiently by the immune cells. Thus, it is a well-coordinated process due to which there is no accompanying inflammatory reaction. Difference in biochemical reactions. Necrosis is a passive process which does not require energy and can occur at any point of time. This is a random event which is unregulated. Apoptosis is an active process which requires energy and occurs in an organized manner. Many enzymes and agents are required to carry out various steps of this process. Summary. Apoptosis and necrosis are variants of cell death that vary greatly in all ways except the end result. Necrosis is a type of cell death wherein the cell dies an untimely death due to uncontrolled external factors, and apoptosis is a predefined cell suicide wherein the cell actively destroys itself to maintain smooth functioning of the body. Apoptosis is a natural physiological process which is required by the body, while necrosis is a pathological process which stems from inflammation and tissue damage.
Approach to fever. Intro. Fever, also called pyrexia, is one of the most common presenting complaints in medical practice. It is defined as a body temperature that is above the normal range for that individual without any physiological cause to it. In other words, temperature raised due to exercise or menstrual cycle doesn't count as fever. This is usually above 38 degrees Celsius recorded by thermometer. In this case, oral and rectal temperature readings are more accurate than auxiliary temp. The most important thing to keep in mind is that fever, in and of itself, is not a disease, but rather a symptom that indicates an underlying disease process. Mechanism of fever. Body temperature is usually set to its normal range by the hypothalamus, which acts as sort of a thermostat. When the body suffers from certain pathological processes, namely inflammation, certain chemicals are released by the body, collectively called pyrogens. In other words, of which is interleukin-2. Pyrogens set the thermoregulatory point of the hypothalamus to a higher temperature, thus resulting in fever. The causes of fever can be divided into the broad categories of 1. Infections, which is the most common cause of pyrexia. It can include bacterial, viral, fungal, or parasitic infections. 2. Clots. 3. Cancers. 4. Autoimmune diseases. And 5. Miscellaneous, which can include things like heat stroke, medications, brain lesions, and thyroid storm, to name a few. Diagnosing the cause of fever. We have mentioned 5 categories of diseases that usually result in fever, and each category consists of a multitude of possible diseases. In order to narrow down our diagnosis, we need to do a thorough history and examination, and request appropriate lab investigations where relevant. Fever is usually accompanied by other symptoms as well, which may guide the diagnosis of underlying disease. Important questions to ask in history. These can be broadly divided into 2 categories. 1. General fever-related. 2. Review of systems. Fever-specific questions include the duration of fever, the timing of the fever, what time of day is it more prominent, the character, is it remitting or relapsing, is it accompanied by chills or rigors, is there night sweating, is there weight loss, is there pain anywhere? Review of symptoms is a systemic approach to identifying accompanying symptoms in other body organs. This is especially important in identifying a possible focus of infection. Ask relevant questions pertaining to each organ system and move from head to toe. So for example, ask about headache, neck stiffness, eye pain, skin rashes or itching, runny nose, ear pain or discharge, coughing, sputum, sore throat, pain on swallowing? Is there difficulty breathing or chest pain? Is there any abdominal pain? Any change in bowel habits? Is there any lymph node enlargement? Any burning sensation while urinating? Any discharge from genitals? Any recent injuries? Any muscle or bone pain? Any recent surgery? Your history will be directed further by the patient's responses and will probably start moving towards a probable diagnosis. Examine the relevant organ system in thorough detail. You mainly need to decide which of the 5 categories does the disease belong to, and which organ system is likely affected. For example, acute fever with complaint of burning sensation during urination points to infection of the urinary tract. whereas chronic low-grade fever with anemia and weight loss might be indicating a hematological cancer. Investigations. After you have narrowed down your focus in the history and examination by thinking of probable diseases and excluding the unlikely causes, you could advise certain investigations for the patient if need be. Remember, it is good clinical practice to avoid unnecessary investigations. Common investigations in fever include complete blood count. The white cell count is raised in cases of infection. Liver function test. Urine routine examination. Chest x-ray. Some diseases are common in certain areas, so investigations for them could be included. In other words, PPD test for tuberculosis and viral antibodies for hepatitis. Cultures for urine, sputum, blood, or pus may be needed in cases of bacterial infection to identify the specific pathogen. Red flags. Although a multitude of conditions can cause fever, as mentioned before, but some conditions are more serious than others and require special attention. Always pay special heed to cases of fever with one of the following. 1. Neck stiffness, low GCS or acute neurological deficits. 2. Severe chest pain. 3. Rapid weight loss. 4. Patient with toxic look. 5. Respiratory distress. 6. History of any recent surgical procedure. 7. Patient who is immunocompromised. 8. High-risk behavior, including drugs and sexual promiscuity. 9. History of travel to an endemic area. And 10. If no obvious cause is found for the fever within 3 weeks, in the last case scenario, it becomes known as pyrexia of unknown origin and requires extensive workup. Febrile seizures. Some children aged 6 months to 5 years may also have associated seizures with an episode of fever. This may greatly worry the patients and their parents, but they should be reassured that febrile seizures are mostly harmless and do not damage the brain. In case the febrile seizures are not being controlled, refer to pediatricians. Treatment. Definitive treatment of the fever lies in treating the underlying cause. In most cases, it is an infection, so the proper antimicrobial drugs should be prescribed. Warning: do not use antibiotics without proper prescription, or use less than the prescribed period, as this leads to antibiotic resistance, resulting in tougher infections. For symptomatic relief of fever, non-steroidal anti-inflammatory drugs, in other words, ibuprofen or paracetamol, may be used. These provide only temporary relief from fever. Please note that no medications are free from side effects, and it is better to avoid taking any medication without any valid reason.